I'm a physician at Living Wellness Medical Center, and today I am going to be doing a presentation for you on IBS. So it's just kind of a short talk about just 5 things that you should know about IBS. And in my practice in the Arcadia neighborhood in Phoenix, Arizona, I mainly see women. I also see men, but the predominant group I work with is middle-aged and older women, and we deal with hormones and gut health. So this is something I see quite a lot of, and I just want to give you an overview on what IBS is and what we can do about it. So I'll start my slides for you. Okay, so 5 things that you should know about IBS. Those things are what it is, what it isn't, how to investigate the cause, what some of the MD treatments are, and then what naturopathic treatments are. So we can see what kind of care you might get if you go see a gastroenterologist or a family care doctor, and then what you might expect to be done differently when you see a naturopath. So first off, I went to the Medscape website and just pulled a couple of quotes from them about what is IBS. And also they had a really cute video that went through what the condition is. And so I'm using some of the graphics from there. So full credit to Medscape for this one. But what it is, Irritable Bowel Syndrome, IBS, it's a functional GI disorder characterized by abdominal pain and altered bowel habits. In the absence of specific and unique organic pathology, that just means this is a cluster of symptoms, abdominal pain and altered bowel habits, and there's not a real disease process underlying it. It's a syndrome of symptoms. It tends to be chronic and relapsing, characterized by recurrent symptoms of variable severity. So again, that's just a way of saying it comes, it goes, sometimes it's better, sometimes it's worse. The symptoms severity can vary from time to time. But again, it is always just a cluster of these particular symptoms. The abdominal pain is something that's created by the nerves in our gut. So the nerves that are in the wall of the intestines and that muscular wall that's the tube of the intestines, we have visceral hypersensitivity. And visceral just means related to the internal organs. So this is the gut. And hypersensitivity. So the nerve sensations in the gut are a little bit more, just more sensitive. We have stronger response to stimuli. So if there's a little stretch in the muscular wall in the folks that have IBS, that's perceived as a greater degree of pain than it would be in somebody else. So hypersensitivity, the nerves are sending lots of pain signals from the gut. The other thing that goes along with it is bowel motility problems, and this can be either constipation or diarrhea, or it can be both. And, in 75% of cases, it can change. You can have constipation and then later shift to diarrhea, back and forth. So knowing specifically what the bowel characteristics are, the motility, whether it's fast or slow, is not as important to know because that could change with time, but just the fact that it's present is what makes this IBS. Some of the reasons that we consider this may be happening, right, where we may have motility differences, is if the body, if we're not digesting and absorbing these particular short chain carbohydrates, lactose and fructose are a couple of them that are implicated there. And we know that just because when people eat those, they can create symptoms. So they have something to do with either creating constipation or diarrhea. And they're really involved with the pain sensations as well, because those food items, those carbohydrates, when they're not absorbed, and that means they move from the intestine, from the inside of the intestines into the bloodstream, right? So that's absorption out of the gut into the blood. When that doesn't happen and those sugars are staying inside that tube of our gut, that can draw water in. And that sudden influx of water being drawn into the gut can make it, can make a swelling, right? Can make a bulge, stretching the tube, that intestinal tube. And that can create a smooth muscle spasm, right? So when there's a stretch in that organ, it can create a spasm. And then the other thing that can those foods, those sugars, can contribute to the pain or to the pain sensations through gas production, because those sugars are fermentable. The bacteria in your gut are going to ferment them, and that's the way that they turn it into fuel for themselves. But during that process, gas is produced. And so when you've got a lot of bacteria producing a lot of gas, and again, it stretches the tube, that's uncomfortable. The nerves send signals of pain, and then the smooth muscles may spasm. And that's, you've got bloating, you've got cramping pain. That's part of this picture. Another way to look at what it is who gets it and why. Epidemiology is who gets it. Interestingly, in other parts of the world, this is evenly balanced between men and women. But in North America, where we live, it's mostly middle-aged women. The predominance of this condition is in middle-aged women. And the onset is usually sometime before middle age, though most people that get IBS, I'd say most people, 50% of people with IBS will have some of these symptoms present before age 35. So it generally tends to start when we're younger and continues on into an older age. Risk factors can be gastroenteritis, which just means like food poisoning, right? Norovirus, rotavirus, those are things you may have heard those terms because they're often implicated when we have really bad events like on cruise ships, right? Where you've got a lot of diarrhea going around. That's gastroenteritis caused by a virus. And that can be a risk factor that sets you up to be somebody who's going to have IBS in the future. Stress is also a risk factor. It's another thing that can trigger this in people. And it's because our nervous system functions in a couple of different modes, right? We're in either rest and digest mode when our body is calm, or we can be in fight or flight mode when we're activated into a stress state. But when our body is activated into a stress state, it changes how our nervous system sends signals to our body and to our organs. So our intestines don't get the nerve signal to be moving things through and keeping that motility going correctly. And so stress chronically can create long-term digestive problems. Short-term, your gut slowed down for a little bit while you're dealing with some stress. Okay, no big deal. It'll turn back on when you're relaxed again. But some of us live in chronic stress and we don't relax enough. And so our nervous systems keep this kind of brakes on our digestive functioning. So stress is something that very directly affects the way that our gut functions. And so it can set us up for IBS. You can see my little footnote at the bottom that in some studies, up to 77% of IBS patients, those are being seen and treated for this condition, also have a mental emotional disorder, anxiety, panic, depression, things like this. Hypochondriasis are put in here because, yes, it's, some people are just always very, very worried about their health and kind of overblow things a little bit. But this isn't just a hypochondriacal condition, right? This isn't just that, you're thinking it's true and so it's true. It's literally true that your body is changing its function because of the stress you're experiencing. So there's that. And this is just another little kind of summary graphic saying that irritable bowel syndrome is two things, two symptoms: abdominal pain and changes in bowel motility, constipation, or diarrhea. And the triggers can be foods like the short-chain carbohydrates, or acute gastroenteritis, that's the food poisoning event, or stress. So this is what we're talking about today, what it is. One of the things that's characteristic of IBS that differentiates it from some other GI conditions, you might be trying to figure out, what this is. One thing that you'll see in IBS is that the symptoms are typically relieved after a bowel movement. So that's something to keep in mind if that's part of your picture. This is usually better afterwards. What it's not, again, here's a really nice graphic from that Medscape website, and it's comparing and contrasting irritable bowel syndrome, IBS, with IBD, and that's inflammatory bowel disease. The difference here is that IBS is a functional disorder where things aren't working appropriately. The nerves are hypersensitive, the motility is disrupted, but there's not a disease state. With inflammatory bowel disease, you have all the symptoms, but you also will have inflammation and ulcers or other microscopic damage inside the intestines themselves. So IBS, there's not actual damage. IBD, there is. Also, in that vein, if you have IBS, you're not, at a higher risk to develop IBD or inflammatory bowel disease. So that's good. It's not the precursor to IBD. It's not associated with the risk of developing colon cancer or intestinal cancers. And it's not associated with any increased mortality or risk of death. So the life expectancy is the same whether you have it or not. What we care about is, it's the quality of life is diminished when you've got IBS. It can really affect, the way you eat, the way you interact with others, when you go to meals, can you go to restaurants, can you travel without having to go to a restroom? Quality of life can be really altered when you're dealing with this, but, it's not going to shorten your life. That's the good thing to know. There are a lot of symptoms that are part of IBD that aren't included in IBS. So I'm just telling you some of the things here that IBS isn't. So if these are, if you're thinking maybe you've got IBS and you're concerned about that, then if you're experiencing the symptoms that are listed here, it's not IBS, it's something else. But that would include, the symptoms being sudden, like a completely out of the blue onset, sudden and acute, not likely IBS. Episodes of fever or rectal bleeding, that doesn't generally come along with this either. If symptoms continue to worsen, that's a condition that's developing, that's progressing. IBS doesn't do that. It comes and it goes, and sometimes the symptoms are worse, sometimes they're better, but it doesn't have a steady progression towards just getting worse, okay? Anorexia, which is a medical term that we use to say no appetite, you don't want to eat. So it's not having the condition anorexia nervosa, but it is anorexia having no appetite or having weight loss is not a part of IBS. So if you're having problems with that, if you're suddenly dropping weight, you don't want to eat, you don't have an appetite, that's generally not part of an IBS picture. Neither is diarrhea that would include blood or undigested foods and fats showing up there. Also, if the onset, the first time you're having symptoms like this is middle-aged or later, unlikely that it's IBS because, again, this usually starts to present in people when they're a bit younger. Now, to rule out those other conditions, right, to say what it isn't, we can do testing, and we would test to look at these conditions, right? We would look for irritable bowel disease or celiac, looking for infection or diarrhea caused by some other illness. If you're intolerant to certain foods, gallbladder problems, we can test for all of these because they present with really similar symptoms. So we're going to make sure that these things aren't happening, and then we can say that it's IBS. Other things, SIBO or SIBO, there, SIBO is how we pronounce that, and it's an acronym that stands for small intestinal bacterial overgrowth. That is a condition that looks very much like IBS, really similar presenting symptoms, but it is something identifiable, and we can, measure for it, find it, and treat it directly. So IBS is something, again, just to dial back, it has symptoms, but we don't have a direct mechanism that we understand that causes it. So if we can find a direct mechanism through one of these disease states or conditions, then we don't call it IBS. Things like problems with your thyroid hormones can also cause issues, just constitutionally. Your thyroid is what sends energy, that stimulates energy production throughout your body. And if your energy production is excessive or too low, that can impair how your gut functions, of course. Other things that we want to make sure aren't the direct cause of your symptoms would be just plain old anxiety or, abuse of laxatives or other medications. So what other medications? That's my next slide here, is to tell you what are some of the really commonly used medications or drugs that can cause the symptoms of IBS. Which, again, if we knew they were happening, we wouldn't call it IBS because we would know that it was just a drug reaction. This is something I'm seeing a lot more commonly. I think all of us are in patients who are using the new weight loss drugs, right? Ozempic, semaglutide, Mounjaro, some of these other IGF-1 analogs, they definitely cause GI disturbances. They can cause abdominal pain, they can cause cramping, they can cause loss of appetite, but that's just a drug reaction or a side effect of that medication. So with these things, we want to make sure that this isn't the cause of it, because if it is, again, you don't have IBS, you just need to adjust the medications you're using. Metformin can also have the same effect, but we can modify that. If you're using that medication, usually an extended release formula will make the symptoms better. There are certain painkillers. Some are prescription, right? And some are just over the counter. And people that use these regularly can have problems with their digestive function that look like IBS. Opioids can cause constipation, right? Really, everything backs up and slows down, and then you get bloated, and you have pain, cramping. NSAIDs, just, over-the-counter painkillers. People use these for headaches and joint pains and things all the time. And people that use those regularly find that that drug degrades their stomach lining. So the mucus barrier in their stomach gets broken down, and that leads to low stomach acid, and it can also impair immune function. But what you're going to see there is symptoms that, again, look like IBS: abdominal pain, bloating, cramping. And antibiotics, I think this is one a lot of people understand or have experienced or recognize, that after a round of antibiotics, sometimes that can give you temporary problems with your digestive function. So we think you have IBS, but we need to make sure we rule out other more serious conditions first. These are some of the ways that we investigate what might be the cause. Do you have an actual IBD problem, or is this just IBS? So with the MD tests, all of these tests are to try to find other conditions that would explain these symptoms. They're actually normal in IBS. So if we see that these are normal, then we're more confirmed that it could be IBS. So there wouldn't be any problems with antibodies to celiac. Ladies who wouldn't have celiac disease. Tests that MDs do are on the left side here, right? So these are some of the things that you go see a gastroenterologist about your IBS. These are the things they may be doing to look for the cause, right? Abdominal ultrasounds and CTs and different scans, things where you swallow barium, and then they do imaging to see how that moves through, looking at colonoscopy, or just looking at an anoscope to look into the rectum. So all of these other things are looking for actual diseases that would rule out IBS, because that's what this is. I haven't mentioned this before, but IBS is what we call in the medical world a diagnosis of exclusion. And that means we look for any other possible reason for this, any diseases, any infections, anything that would tell us why this is happening. And if those are all negative and all the tests come back normal, we call it IBS, because it's just the syndrome that goes with those symptoms that don't have any other known cause, right? So, and that's similar to like fibromyalgia. That's a condition where we test you for every other reason you could have, like pain and dysfunction, and none of those show up. Then we can say, oh, well, that's fibromyalgia. So IBS is one of those sorts of conditions. If it's not an actual disease, we'll just call it IBS. So the tools to investigate used, by the MDs are tried and true. They help us to rule out other diseases. So naturopaths will use that too. In our evaluation methods, in addition to those MD tests, we also are going to always have a really comprehensive health history conversation with you as a patient. We're going to talk about, what illnesses you've been through, what your diet is like, what medications you may be taking or have taken in the past, what your stress management practice is. So we're going to talk a lot about your health and what supports your health to see if we can find a reason for your IBS symptoms. That may include you doing a diet diary where you just write down everything you eat and drink in a day or for a series of days, and then also any symptoms that are associated. So if you eat something and then, later that day you feel a certain way, those are all collected in the information in the diet diary. And then we can just read through that and see if it gives us any direct understanding of your symptoms. Otherwise, we can do lots of laboratory testing as well, right? Blood testing and other sample testing. Food allergies or intolerances, those are blood tests and stool tests. A comprehensive stool analysis is something that we often do. In the MD world, they may do a test of your stool or just really looking for blood, right? So they're looking to see if there's blood there. But in a naturopathic test for a comprehensive stool analysis, we're looking not only to see if there's any bleeding, which again rule out IBS, or inflammation. It's going to show up in that stool test too. Any dysbiosis or imbalances in your gut bacteria, right? If you don't have enough of the good guys there, or if you have too many, hangers on that, don't help you but don't hurt you, they're just kind of taking up room. Also, the stool test will tell you if there's pathogenic bacteria. So if we have anything that's actively hurting you, shows up in the stool test. Another great thing with the stool analysis that we do is it tells us about how well you digest foods. So do those foods come through undigested? You can see that in the stool test. And do you have enough digestive enzymes present to help you break down foods? So comprehensive stool analysis is a really fantastic tool to use when investigating the cause of abdominal bloating, cramping, diarrhea, constipation, these things. Digestive enzyme analysis, we can do a separate test just for that, or that's part of the comprehensive stool analysis. If you have chronic diarrhea, it's likely that you're not absorbing nutrients as well as you could. And so there is blood testing we can do for micronutrient status, which tells us if you're missing anything major, vitamins, minerals, fatty acids, amino acids, other things, other nutrients. Are you having trouble with digesting, absorbing those? We can run a test for that. A simple test that you can do at home too is transit time at the colon. We can guide you through how to do that to give your doctor information about how quickly things are moving through, what that gut motility looks like. More comprehensively, of course, we're looking at thyroid hormones just like the MDs are, but adrenal hormones are also of interest to us. So we would want to do some salivary testing of your adrenal hormones to see if that's impacting your symptoms at all. So that's a test that we do that's not often done by MDs. And then SIBO, I told you there's potentially these symptoms could mean you have SIBO, so we can test for that. And that's a breath test. So we've got different testing we do in addition to the testing that MDs do that are more geared towards, looking for functional causes of your symptoms. Maybe I should have had this fun cartoon up for you to read while I was having a little coughing bout, but here you go. There's just a fun little cartoon. Have you ever had IBS or experienced it? Yeah, it can feel like, things are really turning against you and they're furious and vindictive. So there's that. Now on to treatments. What do we do to treat this once we've decided it's not IBD, it's not SIBO, it's not, any other identifiable disorder? Then MDs are going to treat you just to reduce the symptoms, right? They're going to guide you on dietary changes, which generally mean increasing fiber and increasing water. Those can be beneficial either with constipation or diarrhea. So it doesn't matter which type you have, that dietary recommendation is generally what you're going to get from an MD. Also, they're going to instruct you to avoid some of the known trigger foods for symptoms, which could be caffeine, beans, dairy, gluten, fructose. So those are foods that you'd usually be instructed to stay away from to reduce your symptoms. Drugs that are prescribed by MDs can be, again, all just geared towards stopping a symptom from happening, right? So the antispasmodic stops the cramping of the intestinal wall, so we don't have that cramping pain. Anti-diarrhea and laxatives obviously are just changing the consistency of the stool so that it's softer or so that it's firmer. So medications just change that consistency directly. You also wouldn't be surprised to have an MD prescribe antidepressants or anti-anxiety medications because of the mental emotional component of this. In addition to that, psychological treatments could be the medications or counseling. Okay. What will a naturopath do? We can use the same tools they use, right? We could use the same techniques. We can do pharmaceuticals if that seems the most appropriate. But we're going to go a little further and do some other things too. So if we've done the testing that I talked about earlier, the comprehensive stool analysis, and it shows us there's a problem with your large intestine bacteria, or bacteria, viruses, and fungus, things that live in our gut. If there's some issue there, a dysbiosis problem, we have too many pathogenic bacteria, well, we're going to eliminate those. We have too few of the beneficial bacteria, we're going to encourage those. So this can be using either herbs or pharmaceutical medications, again, whatever seems most appropriate for the case. And then we're going to follow up after treating with a diet that supports the beneficial bacteria, that fosters them and keeps them thriving. Now, if we found that you had a problem with your small intestine through the breath testing for SIBO, we saw that you had an overgrowth there, we're going to balance out the microbiome there by eliminating that overgrowth. And those aren't pathogenic bacteria, they're probiotic bacteria. They're the good guys, they're just in the wrong location. So we're going to eliminate the overgrowth, and we're going to use either herbs or pharmaceutical medications. You've got choices here for what works best for you. There are different time frames, different side effects and things that come along with different agents, herbs or pharmaceutical. So we'll pick the one that fits most appropriately for the case. And then after we've fixed the dysbiosis problem, again, with the small intestine, we want to make sure we're encouraging proper motility, making sure things are moving through swiftly enough, because that small intestine bacterial overgrowth is often caused by a gut motility problem where things are too slow. But that doesn't mean that it always results in constipation, because the motility or the speed that things go through your small intestine is different than the frequency of having bowel movements. That's a large intestine thing. So anyway, with this, if we've decided that it's an imbalanced microbiome causing your symptoms, we're going to correct that in whatever area it is, large or small intestine. Now, if we have done that testing and there's no problem at all with your intestinal bacteria, insofar as you don't have an overgrowth, right? You don't have SIBO. Well, in that case, probiotics are a really fantastic treatment for IBS, and we've seen evidence that you can, supplement and support the bacteria, and in 6 months you can completely restore a good microbial balance. But it can take that time. So the symptoms may stop within the first month or so, but you still need to continue the treatment with the probiotics up to about 6 months to make sure it's fully restored. We can do that via supplements, right? There are probiotics in capsules, there are powders, there are a variety of different ways you can get the probiotic bacteria in you. When we're doing a supplementation like this to try to treat IBS, it is not yogurt and kefir and fermented foods and sauerkraut. Those are not going to have the level of probiotic bacteria that you need for this kind of treatment. You're going to do something that's a much higher potency through a supplement. But then after you have brought the supplements in, those bacteria are now populating your large intestine. They've taken up residence. It's a happy home. Then you're just going to continue to support them and to foster their growth and activity by feeding them the foods they like, right? So making sure your diet is supportive of a healthy microbiome. Alcohol harms them. Fiber-rich foods support them, right? So there are things that we can guide you on diet-wise to keep the probiotic bacteria happy and healthy in your body. You don't have to take a probiotic supplement every day for the rest of your life, because once they're in, they'll thrive and grow on their own with the proper diet. Okay. Moving along, another treatment that naturopathic doctors often use with IBS to help with the symptoms is digestive enzymes. That can be through a supplement that you take with meals, and those enzymes break down your food, so that's digesting it, right? They're breaking it down so you can absorb the nutrients out of it really well. We can also use herbs, other than just taking a supplement that contains the enzymes preformed from another source. We can encourage your body to make more of the digestive enzymes. There are herbs that stimulate your production and release. So those can be really helpful to just get your body making that enzyme again at a proper speed. But eating slowly is really important to allow the adequate release of enzymes and to let those enzymes come in contact with the food. But chew your food to really tiny fragments or liquefied and then the enzymes can get to those and help to break it down and digest it further. So eating slowly, chewing really thoroughly, allows the digestive enzymes to do a job of digesting our food better. So not only might you want to supplement them, but also help our body to make them better through different naturopathic practices. One tool that we have that's pretty powerful in the naturopathic world is called hydrotherapy. And that is the use of movement of water through heat and cold applications, and that moves energy in different ways. So with hydrotherapy, you can do some things at home that can be really helpful with IBS. Castor oil liver packs, Epsom salt baths, and taking a hot shower that ends with a cold rinse. Those things can really harness that energy from moving water, hot and cold. And also, castor oil, it's not using water, it's got castor oil in there, but again, it's kind of pushing things and activating and moving them. So you can do those things at home, and hydrotherapy in a clinical setting will be something like a colonic or constitutional hydrotherapy. These are, some of the tools in our toolbox to help with IBS symptoms. Other than those physical things that we can do to help with the symptoms, there's also, things just counseling and hormone balancing and things like this. So other tools in the naturopathic toolbox would be dietarily, we would steer you away from eating the standard American diet and get to a more nutritious diet that has all the elements, again, for your nourishment, for your body to stay healthy, but also to feed the microbiome or the probiotic bacteria that live in your gut, right? So we want to eat for our bodies and for our bacteria. So we're going to give you some ideas about how to do that when you visit your naturopathic doctor. And also encouraging those good mealtime practices, like I was saying before, eating when we're in a calm nervous system state, right? If our body is in activation, we're in fight or flight or the stress state, the nervous system isn't instructing our gut to process foods, right? It actually hampers the release of digestive enzymes. It hampers the motility or the movement of the gut. So nothing in our gut is working towards digestion when we're in a stress state. So we want to be in a calm environment when we eat. So not eating in the car, not eating over the sink while we're, rushing between activities, but sitting, calmly eating, chewing your food thoroughly. That's just really important for our digestive function to work properly. So that's we'll talk you through those sorts of things to help reduce, again, bloating, pain, constipation, diarrhea, all the symptoms of IBS. Adrenal hormones, why that's important and why we focus on it in the naturopathic world is primarily we've got two hormones we talk about with the adrenals, and that's cortisol and DHEA. DHEA is great. It's just when we're calm, we're generating DHEA, and it's something that helps to rebuild and restore our body's function. The opposite hormone, the one that's made when we're in a stress state, is cortisol. And high levels of stress hormone cortisol works against the mucus lining of our gut, right? I said, being in a stress state impairs our gut function. And this is one of the things that happens, that cortisol directly stops the lining of the gut from building up that nice mucus barrier. And then that can lead to pain, to discomfort. Also, it can impair the immune protection of our gut because that lining also is an area we foster our immune system there. And so if that's not functioning properly, our immune protection is down, we get more inflammation, and we develop food allergies. So making sure that your cortisol hormone level is, high enough that it's helping you get things done during your day when you have to be active, but low enough that it's not disrupting your functioning, it's not disturbing sleep, it's not creating inflammation problems. That's something your naturopath may do that I don't see gastroenterologists doing when treating IBS. So adrenal hormones, again, as well as the thyroid hormones we talked about earlier. Stress management counseling, yes, MDs know, right? It's very well known that mental emotional conditions contribute to IBS, right? I mean, some people it's just as simple as, they'll tell me, when I'm talking to a new patient, when I'm upset, everything goes to my gut. Something upsets me, I get mad about something, I'm disappointed, I'll get diarrhea, I know my stomach will hurt. So it's something that's pretty intuitively understandable to people that, stress affects our gut and it can make it, go offline and not work so well. But stress management is something we're pretty good at in the naturopathic world with training our patients on and teaching the importance of. So mind-body medicine is a whole field that we have. It's not exclusive to naturopaths. Definitely MDs and functional medicine doctors do that too. But we want to talk about how you can harness that mind-body connection to calm your body down, to allow your nervous system to turn all systems on in your digestive functioning. And so, we may have some ideas for how you can do that. But it's always going to involve balancing your activity and your rest, right? We can't be in go mode too much of a day without getting enough rest and expect our body to function appropriately. It's just we need a balance of activity and rest. There's a book that I really enjoy that I share with a lot of my patients that actually presented the data of studies done that showed what percentage of time we need our bodies to be in a resting state and not actively in stress zone, but in a relaxed condition in order for things to function well. And that number is 42%. So 42% of your day really should be spent in a relaxed condition where you're not pushing it and going and stressed, right? And what that translates to in a 24-hour day, that's 10 hours a day. So if you have 14 hours of full bore activity and 10 hours of rest and recovery, that's a really good strategy for keeping your nervous system balanced out, keeping your hormones balanced, but balancing activity and rest. Different ways that you can help your body to move stress out when you've encountered a stressor, right? Something that's triggered you into feeling stressed. Sleep, exercise, meditation, journaling, prayer, yoga, dance, chanting. There are so many things we can do, activities using our body that put us into a relaxed condition, that transition us from being stressed to being relaxed. And these aren't luxuries, right? These aren't things that, when I get time, I'll make time to exercise, or I'll make time for singing. These are things, these activities should be part of your everyday, day-to-day life, right? So you're engaging with these not as a treat, but as just a basic foundational building block of your health. So anyway, I'm kind of getting into a little bit of stress management counseling now. I'll back away, but when you talk to me as a patient, we definitely talk a lot about how you can manage your stress. We'll talk about maybe what your stressors are, and then what you can do to get the stress out of your body so it doesn't disrupt your gut function in this way. I'm going to just finish with this discussion, introducing you to one tool that I personally used when I was experiencing IBS myself, and I've recommended it to many patients, and they've benefited from it as well. And that is an app that you can get on your phone. It's a subscription. There's a fee for it, but it's very reasonably priced. But it's a program called Nerva, and it is a self-guided hypnotherapy practice where you put your headphones in, you listen to the exercises on the app, engage along with them, and it's just little hypnotherapy sessions that help to train your nervous system to react differently to the sensations of pain that you experience during IBS. Because stomach pain, generally we just call it stomach pain. It's your intestines that are cramping, but just, abdominal pain is something that it's really disturbing, right? It can affect your life. It can affect how you behave, your job, your personal relationships, your, social activities. And so that stomach pain, when we experience it, sometimes we get really attached to it and we become very fearful about it happening again. And so this Nerva app with the hypnotherapy is something that can help guide you through reducing the sensitivity, right? Reducing the reaction that happens. So you may still feel a little bit of that intestinal wall stretch. You can feel a little discomfort or pain or cramping, but you learn to experience that and to let it go so that your nervous system can relax so that it won't perpetuate the problem. So I love the Nerva app, and I'm no, my financial disclosure is I have no connection to this company at all other than I benefited from it. I've seen patients benefit from it. And it's just a tool that can help while you're, treating whatever underlying other causes or things may be going on, just helping your nervous system learn that this isn't an emergency. It doesn't need to be on all systems alert, high alert. When you experience this pain, that you can breathe through it and you can be calm. So that, I put a little link here. You can see the web address at the top, Trinerva IBS. And it's showing here in this little graphic on the left that in the study that they did over 6 months, they had some patients who engaged in the hypnotherapy program. Other people engaged in a low FODMAP diet, and that's a diet that's geared towards removing those fermentable carbohydrates out of your diet. So remember those little like fructose and lactose and those other carbohydrates that can trigger symptoms. Some people, the only treatment they do for this is to just cut all those foods out of their diet. It's a really restrictive way to eat, and it can be difficult. It can lead to, some nutrients being missing from your diet. So although it's good for reducing symptoms, low FODMAP is not a long-term solution for IBS. So that one, I would just say, yes, it's effective. We know it's effective, so that's why they compared this hypnotherapy to a low FODMAP diet. And they found that it was not only as effective, but at 6 months, it was still more effective in reducing the symptoms. So love this app, and that's a tool I would recommend. I would leave this time open for questions now. I don't see a lot of people in the room right now, but if you have questions, now's the time to raise your hand. Let me know. Okay, if you have questions after watching this presentation recorded, please contact me at Living Wellness Medical Center and let my front desk staff know what your interest is, what your question is, and I will answer them as best I can. Thank you for listening. I hope you have a better idea now of what IBS is, what it isn't, how we can determine if you've got it, and then what we can do about it. Have a great rest of your day. Thanks for your attention.